Flat feet is a common condition that we treat in the office all the time. Parents would present to the office with their child complaining that their child is quote-unquote lazy. They would say that he or she doesn't like to walk in the mall, does not like to play sports, does not like to run, and that sometimes they like to be carried. Other symptoms for flat feet would be ankle pain when they run and jump, knee pain, lower back pain. These are the most common symptoms of flat feet, or as scientifically we refer to it as pes planus. If you think your child has a flat foot, you can do a quick test at home to see if they have a flat foot or not. What you would like them to do is you would like them to take their shoes off, take their socks off, and find a hard surface, preferably hardwood, where they can stand in a normal standing position. When they do that, take a look at their foot. If their foot looks like it doesn't have an arch in the middle, if they look like they have a bulging bone coming from the inside of their foot, or if you look from behind them and you see that the heel is tilted outward a little bit, chances are they have a flat foot. The question is, what is the treatment for flat foot? When your child comes into the office, usually the first thing we do is we take a thorough history to determine the symptoms and the cause. We would do a quick, what we call biomechanical examination, where we examine their posture, their walking. We would examine their shoulder, lower back, knees, ankles, and feet. And then we would take a quick x-ray to see if their heel bone is in a flat foot position. Once we have determined that the child has flat foot, the treatment options usually include custom molded foot orthotics. A custom foot orthotic is a custom device that we make for the child in the office. Basically, we would take a mold of their foot. This mold gets sent to the lab, and the lab would make them the device based on their measurement. Then you would bring your child back to the office. We would make sure that the device fits the child's foot properly. We also would measure their foot size and make sure that they are putting their device in a properly fitting shoe. And then they start using this device, which will bring their foot into what we call a neutral position. Once we put their foot in a more corrected position, the child immediately experiences relief of pain. Their ankles, their lower back, they do not hurt as much as they used to. They are able to jump and play and run without any concerns about tiredness or getting pain in their feet. And they are happier. These devices need to be checked every year to make sure that they are still fitting. Normally, we would change them every 2 years or every 2 sizes, depending on which one comes first. The question that parents usually ask is, when do we start making these orthotics? The answer is that it's never too late to make orthotics. We can make orthotics at any age. However, we recommend starting at 2 years of age. The sooner we start, the better chance your child will have to grow out of his flat foot and hopefully in a few years wear his shoes without the custom orthotics.